So part 4, prostate cancer. And when I say male version breast cancer, I'm meaning in terms of aggressiveness and kind of prevalence and incidence. And you'll see here in a sec. So quick review, prostate is a gland in the male reproductive system. It's at the base of the bladder, and it really surrounds the urethra right at the base of the bladder. And it's not directly involved with the renal urinary system. It's actually in the male reproductive system, but it declares itself with urinary symptoms. And we'll talk about that in a second. So risk factors, genetics, there's usually, it's the usual family history. Of note, when refreshing my memory about this, there's now an association with the BRCA gene, which strikes me as odd. And unfortunately, I can't answer any questions about that. I didn't look into that any further. Age is a risk factor. It's almost unheard of before the age of 40. It's much, much, much more common in men over the age of 60. Not to make light of it, this is really an old gentleman's cancer. It is much more common in African American men. But for reasons unknown, geography seems to play a role. It is more common in men in North America, Northwestern Europe, not the Mediterranean region, Australian, and the Caribbean. And so I put question marks by that, and it's interesting to see what's the link. It's got to be something environmental or dietary or lifestyle oriented. And then of note here, the usual diet smoking link does not seem to be present here. And if it is present, it seems to be a very, very, very weak link. So no, we can get on people for smoking, but it doesn't seem to be there for prostate cancer. Signs and symptoms, few. And again, they're urinary related. Since that gland surrounds the urethra, and it's right by the bladder, it kind of acts as a clamp. So if you get prostate cancer and the prostate's enlarged and it pushes on the tube that's your urethra, it makes it hard for the bladder to empty, and it makes it hard for you to go to the bathroom. So your bladder gets full, it stays full, and it's hard to pee. So you feel like you have to go to the bathroom frequently because your bladder never gets empty. You have to strain to go to the bathroom. You dribble because you can't pee with a normal stream, and then you feel like you have to go all the time because you go from almost a 100% full bladder and you empty it like 10%, and so you're going and going and going and going. You don't see a whole lot of other symptoms until you've got metastases all over the rest of your body, which is sad. So incidence, prevalence, and mortality. And if you look at these numbers, it's kind of similar to breast cancer. Not quite as bad, but a little bit over 101 cases per 100,000 men, 190,000 plus cases in 159 million men in 2016. You'll note that there are more women alive than men in the United States. Prevalence, about 1 in 9 men will get this during their lifetime. And mortality, a little bit over 19 men out of 100,000 will die per year, which worked out to be a little bit over 30,000 out of that same 159 million, also in 2016. And that was the last year I could really find good full data for, which is why I'm using 2016. There's always a lag in data. So screening and survival. Not really. There's a blood test called the PSA, which looks at surface proteins on prostate cancer, and they are elevated in prostate cancer, but it can be elevated in other things like benign prostatic hypertrophy, which is just normal swelling of the prostate as you get older. And so it's not a great screening test. You can also, doctors will do what's called a digital rectal exam to feel if the prostate's enlarged. And it's just what it sounds like. The doctor inserts the index finger covered into the patient's rectum in order to see if they can feel the prostate. And if it is, they will do further testing. You can imagine that not a lot of men like that for a screening test. So as of now, there's no really great screening test. And we'll pick up there for part 5.